facilitator here today. So Sue Ann Savas is a clinical associate professor at the University of Michigan School of Social Work. She received her MSW and BA in economics from the University of Michigan. And for the past 20 years, she's practiced as a program evaluator, which is what we're here to talk about today. She really specializes in the areas of program design, logic modeling, evaluation planning, implementation evaluations, outcome measurement, and reporting for continuous quality improvement. Using an interdisciplinary approach, collaborating with providers from the fields of social work, public health, environmental health, and education. And she's published a lot of articles and book chapters on techniques for building evaluation capacity within different organizations and coalitions. And then as an instructor over at the School of Social Work, her pedagogy is described as integrating course, field, and life experience. And she uses fully guided instruction and scaffolding models to teach theory and practice, which is what we're getting a taste of today. So also, students' course registration is coming up. Maybe you'll consider a School of Social Work class with Sue Ann. I know a few of you are in those right now. So everyone give a good round of applause for Professor Sue Ann Savas.
Thank you. Okay, can everybody hear me all right?
Yeah.
All right, so lot to cover today. I'm going to be quick, but hopefully not too quick. You did call it a lightning talk. So basically, I'm going to cover two tools that you'll be able to use, hopefully in your nonprofit or as board fellows. But before we get into that, just a little bit about what brought you to today's talk. I'm going to make some assumptions. Your board and funders are asking for impact results. Perhaps you haven't measured those, or you have a lot of incomplete data, you're trying to make use of it. You're pressured to tell your story better, wanting to prove that your programs work, trying to figure out how to do that, how to show that they're effective. You're also having difficulty perhaps showing return on investment. So how much are you putting into the program and what are you getting out of it? You may be afraid you're holding on to programs too long. Some nonprofits are really connected sort of emotionally to the program. It may have been a program that was started right when the nonprofit was started, and they're really wondering, is this time for us to discontinue this program, or perhaps even transfer it as a program asset? Some of you may be struggling to balance mission, money, and capacity, and we know right now with what's happening with the financial crisis, so to speak, the landscape has not been friendly and supportive of nonprofits. So we know that many of you are probably trying to figure out how to balance those things. And so I'm going to show you a few tools, but before we get into that, I want to also just address this definition of impact. What do we mean by impact? And I want to say it's going to depend on who you're talking with. And this little slide comes from probably 25 years of consulting with nonprofits around impact. The term has really changed. The definition has changed over time. But just to notice that nonprofit administrators and staff, when you ask them, what do you mean by impact? This is what they say. First, they say participant outcomes, because they know that that's important. But they also say it's the number of people we serve, the intensity of services we provide. This is a year-long program. This is a 6-month program, right? They say it's the jobs we create for our staff. That's impact. The positive change our organization has on building community. And then we fill a gap in the service delivery system. If we weren't around, right, there would be a gap and individuals would not be served. That's many nonprofit administrators and staff, that's their answer. You move to board members, and the answer really shifts to the organization itself. And they basically say it's how we accomplish our mission. It's financial sustainability. It's the financial health of our organization. That's what impact is. Our reputation, our relationship with stakeholders and donors. They talk about their ability to create tangible results in the community. That's later on down the list, but it's there. And then again, of course, they mention participant outcomes, but really often board members are thinking about the organization. And the last group is philanthropic funders. So we have to ask the question, what do you mean by impact to the folks in the funding community that are supporting and investing in nonprofits? Here they begin with meaningful change in people's lives, communities, and the environment. So they use this sort of concentric circle approach. Measurable outcomes shows up again. Track through data, but also stories of impact. This is important, and we'll come back to this in a little bit, how to capture stories of impact. The causal link between our investment and the resulting change that we've been able to create. And remember, with funders, it's much more aggregate. They're looking at, we've invested a couple of $1 million into this sector, and we want to see how has the sector changed. You know, they're looking at the aggregate. They're not looking at one program at a time. You're often reporting to them one program at a time, but they're aggregating those results. They want to see systems level change. They don't want to see the same problems next year. So they're looking for problem solving, but much more longer term solutions. So this is a little bit about how impact is defined. So as you engage in this work, you have to answer that question. And that's going to help you figure out what should we measure. All right, so my objectives is that at the end of today's lightning talk, that you're going to become just a little bit more interested in using programmatic logic models for measuring participant outcome and using the mission money matrix for assessing and improving nonprofit sustainability. So these are two tools I'm going to bring to you today. And I decided to bring these to you because for me, these tools have had the most impact on my work as a consultant. These are the tools I use all the time to help organizations, programs and organizations sort of rethink what they're offering and stepping back and trying to make decisions about improving outcome and improving financial sustainability. All right, we'll start with logic models. You ready? All right, so I'm going to teach you some things, and then I'm going to test drive your learning. So we're going to do a little mini assessment. I'm going to play a video when I get toward the end of this, and you're going to have a chance to document and craft. So before we begin, I created a little nonprofit for you called Thrive After 65. And I wanted to show you, we're offering 4 services in our little nonprofit: a home nutrition program with a very distinct target population, a bundle of services and expected outcomes. We offer a mental health counseling program. The same thing, a bundle of services. This is important. You need to have a bundle of services in order to be able to logic model. If you're providing transportation service, giving somebody a ride from their home to a medical appointment, we don't need a logic model for that. That's a, you know, people say, how do we measure the outcome of that? Well, they got the ride, so you've given them access, and then hopefully, right, they made the appointment, and hopefully through that appointment, you're going to see an improvement in health, or they're going to get their needs met. Home repair, the same thing, a one-time service. So today we're going to be working at logic models, but at the program level. So those two, home nutrition and mental health counseling, are examples of what you need at the program level. So if you're going to use the tool, first thing you need to sort out is which are programs and which are one-time services. So this is out of the Kellogg Foundation. They have a really great handbook on logic modeling. If you're looking for something that's, you know, like a whole manual on how to do it. So these terms are important. Inputs refer to the essential resources that we need to begin the program. Think of it as sort of the ingredients that we need to start with before we even invite clients in or participants. The planned activities, the outputs are basically the evidence of implementation. So that's like the number of services you've provided, right? The number of the materials you've distributed, all those things. And then outcomes, those are the intended results at the end, and that has to do with participants. So every time we say outcomes, it's participant change. Every time we say outputs, it's actually the work of the staff. So that's how you sort it out. So this is sort of the anatomy of a logic model. Now, they come in a variety of formats, from the most sort of basic linear, which I lean into, and then you have sort of more colorful, creative ones, and then at the top you've got something very creative. And you can find even more creative logic models. So people are taking this format that was developed probably in the late 80s, maybe. Joe Holy was the developer of the initial logic model, and it was used actually for a grant. So people had, in order to secure a federal grant, you had to do a logic model and then a narrative to go with it. But now people are getting really creative with it. And so you can find all kinds of formats. But it's got the basic reads from left to right kind of process. So here's one that's been drafted. Now, this is a very simple one. This is a mental health program for older adults with depression. It's, reads from left to right, the inputs are listed. This strange numbering scheme comes from Joe Holy's initial logic model, where each column is its own numbering scheme. Its own, right? You can see column 1 is the 1s, column 2 is the 2s. In this logic model, you need to identify who the target population is, specifically what they need. You always have to identify a geographic catchment area for every program. So there needs to be a service area. That's really important, especially when we start measuring outcome and reach. Who the staff are they credentialed staff, they community health workers, they volunteers, who the partners are, how the partners are involved, and then where your funding is coming from. So just really short and to the point, those are your inputs and resources. Some people will include space, other things, but it's really what you need to get started. The planned activities, you'll notice everything in that column is worded as what the staff will do, what the volunteers will do, what the administrators will do. The second column is the services provided. And so some students that are new to logic modeling will rewrite the second column and actually put what the clients are going to receive, what the participants are going to receive. But you don't want to frame it that way. You want to frame the second column as what the staff are going to do, because when you start measuring output, it's going to be the work of the staff. So that takes you to the third column. It's the staff who distribute the flyers, the staff who process referrals, screens, intakes, right? The staff who deliver. So output is evidence of implementation, and where's the implementation come from? It comes from your staff. And you'll notice a lot of the outputs are tracked with numbers. It's the number of. When we get into outcomes, you'll see it's the percent of. So then the last two columns are really outcomes at the end of the program, or it could be at the end of 1 year. It could be an artificial endpoint. You could decide. Some programs that are continuous, you have to sort of call an artificial endpoint to capture outcome. Especially with older adults, we hear that, programs are in place until they pass away. And you don't want to put on your logic model, we're going to measure program at time of death. That's not helpful. You want to measure it maybe every 6 months or every year, and so it becomes sort of a time series approach. The 3-year outcomes are up to you. The 2-year outcomes are up to you. Some programs, and when they get going, they really only make a commitment to outcomes at the end of program because they're new. It's a new program and they're trying to understand, right, can we get to that milestone? And then they decide, wow, our outcomes are really strong at the end of the year. Now what we're going to do is measure them 2 years out or 3 years out, right? And so you have to decide. It's not like you have to have a 3-year measurement. You don't have to have a longer term measurement. It's really what you value. The other thing is you don't always have to measure everything you have on the logic model. You can measure certain outcomes, not all outcomes. So just to reiterate that logic models are used to articulate a theory of change. You hear this all the time. People say, we need a theory of change. And you're like, okay, what's that? Well, you can say, we'll show them a logic model and say, is this what you're looking for? Is this what you're interested in? The reason why they call these theory of change is because what you're doing in column B is you're listing out the services and support that you believe will move somebody who you meet in column A to column C. And it's your theory. Today, if we had time, we could take a program, we could take people in need, we could leave the middle of the program logic model completely empty, and I could anchor the logic model with what we think the expected outcomes should be. We could agree on that, and then we would all at our tables identify what we believe will make a difference in moving people from A to C. And I can tell you, every table would have a different idea about how to do that. And that becomes the theory of change, how you're helping people move right through the program and to the other side. So when they ask you for theory of change, show them a logic model and say, is this what you're thinking about? If not, then you've got to go back, right, to the literature and look up theory of change and see if they want you to come up with something else. So a little bit more about what we do at each of these levels. At the end of this, you'll be able to, I think, develop a logic model for a program, perhaps, that you're, of a nonprofit you're working with. So for inputs, we said clearly identify the target population. Sometimes it's demographics, sometimes it's need, sometimes there's a threshold or a cutoff, people who are eligible, people who aren't eligible. We mentioned geographic catchment, referral sources is very important, where the referral's coming from. And we talked about staffing, partnerships, and funding. So that's what you would put in the inputs. And now notice I jumped all the way over to outcome. I didn't follow the model column by column from left to right. When you're working with a nonprofit and you're doing a logic model exercise, it's kind of like running a little bit of a focus group. If you're deciding to do a logic model with your nonprofit for the first time, you'll bring all the people together who are involved with the program. It could be one of the supervisors, a couple of staff members. You'll bring them together at a table, and you'll do this together, and you'll ask them a series of questions, and you'll fill in the columns kind of as you go. You scratch it out, you take them back to your office, and then you'll type them up and bring them back around to see if you were right, if you misrepresent anything, if you were accurate. And when we do that, when we do this process of completing the model, we find that if you go from inputs into planned activities, by the time you get to outcomes, the team is going to start describing their outcomes. We want a fair wage. We want more time off. We want, right? And you've lost the participants. And so I've done this enough that I've learned to do the inputs first, skip the middle, and go to the outcomes. So now you've sort of bookend the model. You've said, right, here is who we're going to work with, what their needs are. You go to the other side saying, when we've been successful, what will success look like? That's what we put in the expected outcome column. So now you have those two anchors, and then you bring your group back into the middle and talk about, well, what are the activities that you provide, right? And so for outcomes, these are some tips. You always sort of start the column by saying at the end of program, participants will. It leads you into an answer. Participants will improve their coping, reduce their mental health issues, right? Improve their financial literacy, things like that. The outcomes should be listed in the order you expect them to appear with the participant. So it's not, I mean, you can brainstorm them to begin with, but you really need to go back and reorder them. They are listed individually, meaning don't stack outcomes. So you don't want a whole list of them all separated by commas, because when we get into measurements, you're going to need to measure them differently. You measure coping differently from how you measure stress. And so at some point, you'll attach measurement to that. There should be outcomes for each group that's receiving the services. So sometimes you have a program where you're helping children, and then you're also helping the parents. And so you want outcomes for the children, and you want outcomes for the parents, anybody that you're intervening with. All of this is written as participant change. So things are going to improve, they're going to decrease, they're going to increase, they're going to maintain. Sometimes maintaining is good, depending on the participants. But you want those terms to be included in this particular column. We'll include evidence when measurement is occurring, and some logic models will have standards where you're actually shooting for 80%, shooting for 75, 82. And those numbers will come sometimes with, sometimes they'll come with your funding, so it'll actually say what they expect you to achieve. Sometimes they come from your history of what you've been able to achieve, so it's an internal standard. And sometimes it comes from benchmarking. So, you know with a particular program that we need, everybody's kind of hitting 85%, and we also need to be able to hit 85%. So back in now to planned activities and outputs. This is where the components are presented in a logical order. So I usually list out what happens first, that you'll process an intake, you'll do an assessment, you'll provide some, initial services. I do it in the sequence of kind of the flow of the participant, how the participant will experience it. But it's always about who does what, when, and where, what the staff are doing, which staff are helping in what ways, what they're offering. This section also includes what we call dosage. So this idea that programs have frequency and intensity to it. So is the program 3 times a week for an hour? Is it 5 days a week for 6 hours a day? That's going to be a more intensive program. So that needs to be included in the planned activities. And then any sort of relevant timelines or milestones, like this assessment needs to be done within 5 days of intake. Now, as I list all these out, you're probably thinking, what font size do we need for this logic model? Things are getting very detailed. So I would say don't go any lower than 9. And try not to add extendo flaps. My students always want to print their logic models on like giant legal 11 by 17. No, just a regular piece of paper, an 8 by 12. But they are often presented in landscape format. But the process, I think, of sitting with a team in a nonprofit and doing a logic model is the way to go. Having that conversation and having people, really hearing people talk about who it is that they're going to serve, and whether it's a model you're using for a program that's never been opened, a brand new program from scratch, or it's a program that's been running for 10 years. The focus group format of sitting and talking through it is really valuable. So think about maybe how you can introduce this with your nonprofit. So what we're going to do now is we're going to listen to a little news report about the empowerment plan. It takes place in Muskegon, Michigan. And what I want you to do is jot down the impact that you hear. What impact are you going to hear in this report? And so there's lots of impact. So I want you to it's a little bit of a scavenger hunt. You're going to listen and jot down the impact that you hear. And then we're going to sort it, okay? So before we get into listening for impact, are there any just general questions about the logic model? How many of you already know about the logic model? A couple of you do. Okay, have you used it? Has it been effective? Yes, people like it. No, not so much.
We had a lot of logic models.
You had too many?
Yeah, we had too many.
Is it all at the program level, though?
Yeah, we had a lot of programming, and each of them had logic models.
Okay. When I first started in evaluation, I was working for a very large nonprofit. We had 22 different programs we were offering in 2 states. And when I helped bring the logic model into our organization, and I had it in those, landscape sheets of paper. And the exec just looked at me and said, okay, this is not going to be helpful. And I go, why? And he goes, I need them to be small, laminated, and I want to put a clip on them so I can put them in my back pocket. I'm like, what? He goes, no, they're going to be helpful. It's just the size of paper. So we went into the printing place and he had them all laminated because he used them to set contracts. You pull them out of his pocket, when he was at a meeting with the government and say, we offer this, and everybody's looking at this little logic model. But he used them that way, I thought he was rejecting the whole concept, but he actually said, no, I need them, but I need them in a different format. So it can be too much when you've got lots of different programs, but they're essential for measuring impact, for sure. All right, you ready? Let's roll it.
This World Homeless Day and resources of experiencing homelessness along the lakeshore, dozens of special coats were donated to the Muskegon Rescue Mission.
Thanks to a partnership between the DTE Energy Foundation and the nonprofit that made them, here's 13 on your signs, Charlie Tinker.
This is the Swiss Army knife of jackets. Morphic from a heavy-duty parka into a sleeping bag designed and built to save lives.
This allows them, if they need that option, to be able to do that safely.
Dan Scopeland is the executive director of Muskegon Rescue Mission, which got 30 of them to give away as the weather turns colder.
It gives us a new and different way to be able to care for people in our community that are experiencing homelessness and need to have a warm, safe place.
Alyssa Novoselic demonstrates how the coat does its job. From parka to sleeping bag and back again. Simply undo the Velcro that gives it its shape, and the process is over in mere moments. And just like that, the potentially life-saving gear's origin story is almost as unexpected.
It was founded in 2012 by Veronica and Scott, and was really only meant to be a class project coming out of the College for Creative Studies.
That semester worth of work 10 years ago became the Empowerment Plan, a Michigan-based nonprofit with an international distribution network. Its website shows the coats have made it as far as Africa, serving families in need worldwide.
We are upwards of 70,000 coats that have been distributed.
Each of them made by hand at the organization's Detroit production facility, using high-quality weatherproof fabric by skilled workers, many of whom know what it's like to need one.
We take people out of shelter and offer them an opportunity to learn textile manufacturing, but also provide a lot of wraparound services.
The rescue mission says the coats will be given out to those guests with the greatest need, a need that appears to be on the rise.
The request for shelter is up over 35%, and the request for food is up over 40%. So the need is growing, and we're anticipating it's going to continue to grow even higher.
In Muskegon, Charlie Tinker, 13 on your side.
Okay, thanks, Annalise. All right, so let's take a minute and share the impact that you heard in the news report with the folks at your table. Let's see what you came up with, and sort of where the impact fits along the logic model. Like, what did you hear? And maybe what's missing, what was missing from the news report. All right, so I'll give you like 5 minutes. We've got a lot to cover.
And then, yeah, would you want to chat about it? Okay. I wasn't sure, like, hey. And I suppose it was just like, maybe the news. Right? I was kind of confused. It says on there, I was wondering, how does it
training and type stuff, not just like other training aspect. Yeah. Having it and give that to someone. I don't know. The same thing. Right. I mean, I can imagine. Put yourself in someone else's shoes. Yeah. I'm dying to do that.
Yeah.
And I also kind of felt like they were actually like how they just shelters, where does their funding come from? What is there? I cannot do it. Some of it, I look at it and I'm like, oh, reading it over here, but I just like, I've gotten better over time. Some of them I'm really like,
No, and I know.
sure it depends on in this class, they're not like, how much will you no, and then other points, it's a scribble class.
Oh, yeah, they're distributed across
Because there was so much left, so I was like, I don't.
Well, I mean, like, what are they doing?
All right, we're ready?
Okay.
All right, so who wants to share? Anybody? We could go with the online list. Go ahead.
We said like their biggest impact is that they, keep people warm and gives them kind of a place to sleep. And then their second biggest impact is the like job services that they provide. And
The
then-
workforce development by hiring folks, right? Okay.
And then we said one thing that like was maybe missing from the video of like impact that they didn't describe was like the other like wraparound services that
Okay.
they said went with like the workforce development piece.
So this particular shelter, yeah, we were talking at our table about how they give out the coats, and that's really important. That would be listed in the logic. If this was just the coats, we might not need a logic on. But once you say to folks on the street, we have a coat for you, we want to bring you over to the shelter, and we're going to give you the one with the right size. And I was saying to Kat, who actually was you were
COO.
You were COO of the empowerment plan. But I would say I would strategically put the coats in the back of the shelter to sort of, walk people through so they could see, because a lot of times people have these assumptions or misunderstanding of what the shelter's all about, but imagine you had them walk through and they could see it and be like, oh, I could maybe stay here a couple nights if things get cold. And then you could also do a little bit of wraparound work, like if you need this, we have that, if you need this, we have that, right? So the beginnings of that to just introduce them to the services. But you're right, I mean, so you get the coat and we would see, I would assume, less hospital visits for frostbite, right? Those are things you could measure. But I didn't really hear how the individuals who received the coat were feeling or what they thought was the benefit. We're assuming, right? We know it's gonna be warm, we know and maybe they'll be able to stay outside, which is what they would prefer, so we could assume that. But to really talk with them and to hear from them, I think at this point, at least, and it may not be missing completely, but it was missing in the report. Okay, anybody else? So we said workforce, any other impacts? What if you were funding this? Yes?
For the people online.
Oh, yeah. More of a question that we discussed was they said that they analyze the people who need it the most. And I think it's important for us to better understand on what basis are they ranking that or actually identifying who needs it the most. And I think it ties into what you say. What do they really feel when they receive the jacket, and then actually analyzing the benefit of it.
So if we did do a logic model of this program, right, would we indicate when we did target population that these are the individuals who need it the most? We would have to figure out how you would assess that. I mean, I think with a program like this, you like somehow announce it, you get the word out. Sometimes it's word of mouth, actually, from people who are unhoused. They'll say, hey, where'd you get that coat? And they'll point them back toward the shelter. But you would need to determine that. And I think it would be hard to figure out who needed it most. I mean, my guess is for Muskegon, they got the 30 coats and they were like, first come, first serve. If you're coming and you need a coat, we're gonna give you a coat. But yeah, that would be an important question, I think, to ask. Anything else? Any other impact did you hear? What if you were a funder? What was impressive about where these coats are going? Nobody noticed the little map? Oh.
Yeah, I feel like the scale of their supply chain is kind of impressive to me because they're utilizing the international distributions. Also, they're utilizing the local workers to do the handmade job. But like others mentioned, their final impact on whether they bring the value add to the individuals, it's a question mark for me.
Yeah.
The scale is quite impressive.
Yeah, they have quite an operation, and there's impact at multiple levels, and now they've got this international distribution, which I think is very impressive. But are we solving the problem of people living on the streets? we're not, I mean, we're keeping them warm, we're keeping them safe, we're preventing them from getting frostbite. But, you know, so some funder would say, we're just gonna keep making coats and handing them out. When are we gonna help them find housing, right? There are other funders that are gonna say, let's keep making coats and handing them out. This is exactly what we should do until we can figure out how to give them housing, right? So each funder's gonna, this goes back to what I said initially about definition of impact. You know, each funder is gonna have its own approach to how they define it. Any other comments on this little exercise? All right, so now when you listen to news reports, you can say, hey, wait, there's impact, or wait, there's no impact in this story. So you'll have an ear for it. All right, let's, so this slide is really to say to you, once you lay out your logic model, you can plug a data collection plan sort of straight into the bottom of it. So think of the first row as being your logic model and what you were hoping to measure. You're going to pull that right off. And then you lay out a data collection plan that's sort of what I call plug and place right into each of those columns. So for outputs, you can measure referral and intake. You can use a service log, a satisfaction survey. You can track services provided. For outcomes, you can use standard scales like coping scales, PHQ-9 is an example, the patient health questionnaire, and stories of impact. And so I put that in bold because I want to lift that up. Qualitative collection is really helpful when it comes to measuring outcome. And so I wanted to introduce just one way to measure stories of impact. I was talking with Kat while you were all listening for impact, and could we have talked with the individuals who received the coat about what the coat meant to them? You know, would that have been an appropriate thing to do? Would that have been informative? Could we have done that in a way where we were respecting them and we were, right? And we were treating them with dignity and we were having a conversation? We would need to incentivize it anytime you collect information like this, where you're sitting somebody down and having a conversation, you would need to provide an incentive. But this most significant change story protocol was developed by Rick Davies and Jess Dart a long time ago in Bangladesh. And they were basically doing some international work and they needed to measure outcome. And they had brought, you know, a whole satchel full of standard scales, anticipating they were going to give people surveys and capture pre and post data and things like that. And they got there and they basically found that these scales were not working at all. And we needed a story, we needed a narrative, we needed to engage the clients in storytelling. And so this is a simple 4-question protocol that basically says, tell me how you first became involved with the program, what's your current involvement. From your point of view, we want you to describe a story that best represents the most significant change that resulted, right, from the program. Why was the story significant for you, and how, if at all, has the work of the staff contributed to the change? And so the first question is a warm-up, where you're just sort of trying to build rapport and relationship. The second question is really where you're trying to get what was the most significant change. With sometimes when we run this, we'll let people know in advance these are the 4 questions. Sometimes when we do it with adolescents, they want to bring a photo that they want to talk about. You can do it on Zoom, you can do it face-to-face, you can do it in lots of different formats. But what I often do when I capture story of impact is to say, I'm looking for the beginning, the middle, and the end of your story. You know, so start me at the beginning. Tell me how you came into the program. And so they'll follow a sequence. And they'll use their first person. I did this, the family did that, we found this, right? And when you write up your story, their story, you write it in that same way, the first person. You obviously would need a consent for this. You draft the story, write it up, and take it back to them to make sure that you didn't misrepresent anything. But the last question is really trying to connect the work of the program to the outcome. And so you have to include that last question. Because they may have had a most significant change experience that had, imagine, nothing to do with the code. You want it to be linked back to the code. So this is a really great, simple way to collect stories of impact. So the question really becomes, if we were going to use this with the empowerment plan, let's say the empowerment plan was our organization that we were supporting, how many stories would we need to complete in order for it to be enough stories, right? And I just want to say at this point, evaluation is applied research. It's like you're working in the community. And with qualitative collection, sort of the rules of sampling don't apply. So I wouldn't need to say, well, let's see, we've given out 100 coats, so we need to reach, 85 people to have the right confidence level, and in order to be able to say that the 85 people we talked to could be generalized to the population of 100. In qualitative collection, I would say if we could start with 5 or 6 people who picked up the coats, that would be great. And maybe in the next community, we could get to 6 or 7. I would say just capturing the stories and capturing the voice of the recipients of the coats would be a great start. I wouldn't set 85 as my goal, right? I don't need to generalize from the stories. I just want the stories to be used as little cases and, right, the voice of the participant. Funders really appreciate stories of impact. So anyway, this is a helpful protocol. I gave you a link. You can find the most significant change guide. It gives you all the how-tos on how to do it. But I wanted to give you at least one method in between all the tools I'm presenting today. So just to recap on a completed logic model, it's basically, it can give you the theory of change. It can give you a shared understanding of the program within the organization as well as externally, so it can be used for messaging, marketing, things like that. It gives you the intended metrics that you want for success, both at the implementation and the outcome level. For sure, it gives you a more relevant evaluation plan because the eval plan is now going to plug right into those expectations. Can you see any other benefits in the logic model? Nothing else? Those of you who've used it? Okay. Anything else? Nothing online? They're typing. Any other benefits? Sure.
I would say, like, as maybe a follow-through for shared understanding, it offers a living document from which to, like, build future understandings,
Yes.
which is, like, kind of the same.
Yeah,
but, like,
it
often,
is.
like, inertia is a big issue within nonprofits,
Yeah.
and like even the starting of a program without something to build from.
Yes.
So creating a foundation for future programming.
It does, and I often do it annually. Because what happens is if you're doing evaluation, you're going to learn about what you need to change, and then you change it, and so the logic models become dated. They're almost like an artifact that you capture annually, and so you use them. You document the change in the theory of change, right, as you go. Did you have something, Liz?
I was just asking to repeat.
Oh, did I repeat it enough?
Enough.
Okay. All right, so we're going to move from logic. Did you have a question?
Yeah, well, it was more of a
comment.
comment, but what's good about it,
Sorry,
I think, so I come from a STEM background and involved in a lot of community engagement, but I think one of the benefits it also does is it really creates kind of like a quantitative data of your qualitative projects, right? Because, it's kind of hard to measure community happiness or these abstract concepts like impact, but it kind of creates numbers for the people who need numbers. So and I think when you talk about involving like different funders and investors, I think it's really important to have different ways to show your success.
Yeah, it does. It's very hard, and it's linear too, right? And so for some people, it's really helpful to understand the program that way. It sort of carries you through the participant's experience from left to right. But it does give you the indicators, I think. And remember what I said, you don't need to measure everything. And so sometimes people are like, well, then why should we put it down? And it's like, well, that's part of the logic model, the intent. You need to understand the full intent. Maybe you're not going to measure community happiness, but you'll measure community connectedness, right? And so that's going to be a proxy, perhaps, for intent. All right, let's jump into the mission money matrix, right on schedule. All right, so this is a wonderful process that was developed by Bell, Masoka, and Zimmerman, and this is the little orange book that they describe it in, and so you can certainly find that. What we're going to do now is we're going to look at, this is a tool we use with the total nonprofit, and we look at programs within. So this is the XYZ Community Center, and these are their programs. They have a sports league, summer programming, a community festival, job placement. And what we're trying to do now is figure out which programs are profitable, which programs are impactful, which ones should we keep, should we grow, should we close, which ones should we try and increase impact. So this particular tool is helping you make decisions within the organization, but in comparing programs. So this is the mission money matrix. It's a very simple quadrant. It's profitability is on the x-axis. You've got impact, right, on the y-axis. And basically what you're going to do is gather information about your programs, and you're going to plot them on this particular matrix. Does anybody use the mission money matrix? A couple of you have. Okay, good. All right, good. You'll have things to add. So I want to give you the steps in doing this. This is, of all the things I do with boards, this is the one tool that I think the boards I've worked with are most excited about. It just gives them the information they need in order to figure out how to move the organization forward through the programs, through the program decisions they need to make. So there's a data collection phase where you have to capture impact ratings, and sometimes you do it through a survey or through an interview. You need financials, you need profit loss and expense data. You move that data into a data table that I'll show you in a minute. So very simply, you lay out your business lines, profitability, mission, impact, and expenses. The only challenge with some of this is that some nonprofits don't have their financial data organized by program. And so sometimes you have to sit and disentangle finances and organize it at the program level. Step 3 is you plot the results. So I've had board members do it by hand. Literally, we'll do it at an activity where I give them all the data and they're plotting it on a big sheet of paper on the table. Sometimes you can insert a bubble chart and do it that way through Excel. But you want to plot results. And then you want to use the results for action. And so there's a result table that really helps you organize where the programs land on the quadrants, and then what action is recommended in order to move that program forward. And the whole goal really is to strengthen the organization. So we'll walk through the steps. This is the survey. There's 2 pages to it. You're rating 7 impact areas, and you can really adjust the rating scale if you need to. This is does not meet criteria all the way to fully meets criteria. I've worked with some organizations and they say, well, if it doesn't meet criteria, why'd you give it a 1? It should be a 0. And I'm like, I've given it 0 before, and then I've been in another organization, and they're like, nobody wants a 0, so we've moved it to 1. You can decide how you want to do that. It just depends, but it's basically a 4-point scale, and if you want to make it a 5-point scale, you can. So this is up to you. But you're rating impact, these impact areas have criteria, so they're sort of defined. Alignment with core mission is important, excellence in execution, so it's exceptionally implemented program, effective outreach, there's evidence-based practices, effective follow-up, it's really well done. Scale is important, we mentioned scale a little bit earlier, so how many people are touched, served, or influenced by the program? The depth is also important, and this is where outcome attainment comes in. The intensity of the program and the depth of the impact on participants. The second page, these are a little trickier now for people to rate. So you really need to understand the program in order to do this rating. And so that's why sometimes I do it sort of with a focus group or through an interview, that kind of a thing. So I can really make sure that people understand it. Building community or constituency is important. So the program is actually building community and supporters sort of beyond the organization, right? It fills an important gap. So is there a high demand? Is there a wait list for the program? Are there other programs offering the same thing in the same community? And then leverage. Does it increase the impact of other programs within the organization? So one way to think about that is if you took the program away, would the other programs like suffer because of that? And it has to do with increased demand for another program. Does it raise funds, for the whole organization? Is it develop tools that the other programs use? So really, one way to think about some of these things is if you took these away, what would result and how would it affect the whole? So there's a survey that everybody completes. Sometimes you can have the program manager complete it alone. I always worry about that because I feel like there could be a little bit of bias, right? I'm responsible for the program, so of course it's great. I'm going to give myself all fours. I worry about that, so sometimes I'll use multiple people within a program. Sometimes I have board members that say, I want to learn more about this program. I want to be a part of the rating, but then you have to do some discovery to get them to a place where they feel like they understand, right? Enough information to be able to rate. So you complete that, and that goes in the mission impact column, so you can see the rating there, and these are average scores for each of the programs. The financial data, it's the profitability is in the red if things aren't going really well, and then you've got your expenses there, and those are all at the program level. So this is really the data chart you need to make the bubbles. On the bubble chart, you've got your horizontal axis, your vertical axis, and the expenses are used to the size of the bubbles. So that's important because as you see you're making decisions, you may say, oh, we really need to grow this program. And you're like, oh my gosh, look at the expenses. It's huge, right? Like, wait a minute, you really need that number in order to make some of these decisions. You might have a really low cost program, right? But there's very little impact, so these are all things that kind of come together, and you'll see in a second. So you lay out this chart and you place the bubbles onto the matrix. So you can see on this one, well, I'll show you in a second. So you place them first and then you add the labels. So you want, if you look in the right where the star is, I always start with the star, so that's the positive. We've got the high impact and high profitability, and that's exciting. But you can see this particular organization doesn't have anything squarely in the star. So then I go down to keep watering. So now we have a profit. See where the little tree is? Keep watering. It's like your money tree. Keep watering it, increase impact, meaning it's making money, but the impact is low. And so we don't have anything in that particular quadrant either. If you go to keep and celebrate, you can see over there, we've got a couple of programs. No surprise. These are programs that are important. They're what we call the heart of the organization. They were started at the very beginning. They mean a lot to the people who work there, but they're losing money. Sports leagues like breaking even, but the other two are losing money. And then you go further down and you see the stop quadrant, close or give away. So these are two programs that have very low profitability and low impact. So they're in the low quadrant. And so right away, you can see that this particular result is going to create a lot of anxiety. If you were presenting it to all the managers, they look for their program and they're like, oh no, we're sunk, they're going to close us. This tool, you have to be really thoughtful about what you do with the results, how you present it, who you talk to, right? Because it can be really anxiety producing.
Just curious about the forest quadrant. Do we have to make every activity impactful?
It feels like if organization has some activity or creating profitability, you can let other program can be benefited from this profitable program. So it doesn't have to be all the activity like impact.
Does it have to, do you want your program to be high impact? You can be okay if your program is in the keep watering, increase impact area as long as it's making some profit, or even breaking even. Like some people would say the sports league's just fine where it is, right? But look at the STOP programs. What happens when they're in that low quadrant is you're trying to say, what can we do to increase impact? What can we do to improve profitability? You're trying to get the programs to the right.
Oh. So it's not a portfolio perspective, right? It's like some activities are, they're creating for impactful. Some activities they're doing for profitability.
Yeah, but a nonprofit generally wants to see impactful programming.
Okay.
And they want to see that they're not losing money. And so you'll see in a minute, there's a strategy on how to do that. But this is one organization, and so what happens with something like this is you can see how they would maybe begin to compete with each other. So you have to be really thoughtful. When I do this with nonprofits, I'm usually meeting with the first set of results, I'm meeting with the CEO and the board president. And we're looking at results together. And we're trying to figure out, where do we go from here? What is this telling us? I've done these with boards, and they ask me to come back every 3 years because they make changes. And so then they run it again, and they run it again. So this is the planning guide that you use. Once your program is in the star quadrant, you can see that what you want to do, right? You want to grow those programs. You don't want those programs to be subsidizing the programs that are losing money. The hearts is where you're really now trying to figure out, how can we contain costs? So sometimes improving the profitability of the program is really around containing costs. And so for some, you haven't really thought how to do that yet. You know what I mean? Like, you want to ask yourself the question, what can we do? The money tree programs is generally what happens is those end up subsidizing the heart programs. And so you have to just decide, is that what we want to be doing? It's not like there's a right or wrong. Each nonprofit sort of takes these results and decides what to do with them differently. It's what now they have the information, and they can say, this program over here is really bringing in the money to cover this program over here. And is that good? Do we want to keep doing it that way? And some groups will be like, that's fine. Because this heart program is so important to us, our reputation, our history, we're not letting it go. But at least you go into that decision with some sort of level of intentionality or strategy. So basically what happens is you create this sort of imperative chart where you list out the business lines, the quadrants, what your imperative is. So for everything that's a star, you're going to try and invest and grow it. And then what action you're going to take to sort of move the work forward. You can see for the heart programs, we're trying to keep and contain costs. Job placement services, close or give away. For me, I don't know how job placement fits into just sort of, the programming feels very youth-focused and community-focused, and so if the job placement service is for adults, I'd ask the question, should we be getting into this business, or does this program really belong with another nonprofit, down the street? The community theater, they say close and give away, but the community festival's doing really well. So my first thought is, why don't we integrate the theater into the festival? Like, why do we run it separately, right? Why don't we move the theater and do a showcase at the festival? Maybe that's going to be a way to keep that particular component. Otherwise, we need to just reduce the staff and move into a volunteer mode. It's another way. So I want to give you a practice. We have 10 minutes to practice. So I want you to scratch out on a piece of paper a simple quadrant, and I want you to plot these programs quickly at your table. We have time. We have 10 minutes. Plot these programs, and let's see what we find. Mental health counseling, extremely profitable. Early childhood program, academic tutoring. We have an after-school and enrichment and a job training program for teens. Looks like a pretty common nonprofit. You have to draw the little quadrant. All right. Rough it out, those of you that are really detailed. It's okay if it's scratchy.
Okay, so mental health counseling is very impactful.
Yeah.
Processing.
Correct. Mark them in.
High impact, very profitable. I would say, maybe that's more.
The expense, the
Expense.
yeah, but you might have trouble estimating that.
It's very expensive.
You might have trouble estimating the size of the expenses, right, for the bubble. Don't worry about that, but trying at least to get the scale right. So for the profit, you can see the scale's gonna go from negative 175 to positive 167. Anchor your, right, your x-axis. And then for your mission impact, you can go from, right, 1 to 4, perhaps? Or 0 to 4?
I think
Oh, okay.
yeah, absolutely.
Okay. And that one.
So life skills is high.
So I think.
No, it's important to know that.
You've got it, but you'd anchor it with
This
the-
one should use.
Yeah, but I mean the money, like, negative, this is your 167.
So let's put in that level life skills.
Yeah, that'd be interesting.
You guys doing it?
Next, most expensive.
Yes, that's right. You should get the hang of it, just scratch things out when you do it.
Like a little bit.
You guys doing it?
I know what you guys are doing.
Very effective tool.
Giving them information they don't think that their program's against each other.
Very high, very profitable.
Yeah.
Very.
Should be like above.
So I would do it.
Yeah. That's the size of the bubble. Well, it's the size of the bubble because you can't, if you're gonna make a decision to keep the life skills workshops, no matter what, that's a $350,000 cost. And your program in that the money tree quadrant has to cover that if you're gonna use it. Well, I'm just saying, if you're gonna carry a program that's not doing well, yeah, you carry the rest, whatever the loss is, the 125, but I mean, you have to know that, because when you go, I only got one in the, one program, they want to do cash out. So you have to know that.
All right, everybody's had a chance to scratch it out.
Like, we tried doing this.
Okay. All right, so it got a little messy, I'm sure, right? Because you were scratching it out on paper, but you know, you can easily move this into a bubble chart using Excel or something like that. So let's just see what the results are. It's not working.
They've been actually terrible wages.
You can just move it. There we go. All right, so this is sort of what it looks like when you do it in a bubble chart. Yours should look probably close to this. And I had a few questions about why do we need expenses? Why do we need, I mean, you know, the loss, like Life Skills Workshop, you're down to $150,000 for that. And could you use the early childhood program in the money tree quadrant to cover, you know, to cover the loss that the Life Skills Workshop is incurring? And I don't think you can. I mean, it's just not enough. So give me a question you would have about these results. What would you do? What action would you take? Jess?
I appreciate it.
So in this example and others, I'm wondering if you have a lot of things on like the high impact but not profitable side, how you make decisions about prioritizing what you might keep and what to get rid of.
Yeah, I mean, you're basically saying, what do you do when the results are not good? And all the programs are clustering on that. Well, this is how I feel about it. I feel like information is power. And when you know that the programs are having trouble with impact, you have to ask yourself the question, is it time for us to move into evidence-based models? Is it time for us to increase the scale of our programs? Is it time, you know what I mean? There's things you can do to build impact. I think where a lot of nonprofits start to panic is on the profitability axis. So when they start to see like the job training program for teens, they're like, no, we love that program, And then you're like, okay, but what can we do to contain costs? Maybe we need to change the staffing model. Maybe we need to move that to a sliding scale fee. Maybe we need to develop a revenue generator. It gets you to start thinking about what else could we do. All these programs are valuable. Then what can we do to move them right into a place where they're profitable and we've raised the impact a little bit? So I think it's really helpful. Like I said, when I've used it with boards, and you can't rush, there's sort of it creates a shock, the bubble chart. I've found over time when I sit with the CEO and the board president, I don't say anything for a couple minutes. I just let them take it in. And then slowly, right, we're like, where do you want to begin? And they're like, let's talk about the mental health counseling. I knew we should have done that. I knew that program was going to be a good decision. And they'll start with celebrate their positives. And then we make our way around. But a lot of times we don't make decisions right away. We ask questions and then we go back in and get more information, right? You can go back to the survey and say, well, what brought the impact down? Was it one of those items or was it generally low all the way through? You end up going back into the data. So this is sort of how it turns out, and then you have these conversations, and like I said, you don't leave the meeting closing programs. You leave the meeting saying, what more do we need to know, and what choices do we have to strengthen the programs that we have? So this would be the results table that you would complete. It would go with the bubble chart. And then I just wanted to do a quick debrief on the matrix. Did anybody find this to be an interesting or helpful analytic tool for really bringing profitability and impact together for nonprofits? Okay, do you think you could suggest something like this to the nonprofit you're working with? I mean, you could certainly borrow all the slides, take what you need, but I mean, the idea of bringing it to them, I would recommend grabbing the book too, learning a little bit more about it. There's a few articles out there on it. Any other feedback on the matrix? Yeah.
I just had a quick question. So I know you mentioned for the logic model, it typically wouldn't be used for programs that only offer one type of service, right?
Just one, it's not one type of service. Like mental health counseling is one type of service. It's actually a one-time service. You go to a food pantry, you grab groceries, and that's all you do. There's no wraparound you mentioned, there's no other services. That's like giving somebody a ride is a one-time event.
Okay.
So you don't need it for that. You need it when there's a bundle of services.
Does that also apply for the mission money matrix, that you wouldn't necessarily do it unless you were talking about an organization that was providing a bundle of services within a program?
Yeah, these are very much programs. I mean, you could potentially think about a transportation service. I suppose you could use it for that. Because perhaps you've purchased a van and it's costing you a lot of insurance and maintenance and you're only doing 3 rides a week and it's really not, right? So yeah, I think you probably could. I would take it one program at a time. I would try it, see what you have.
Thanks.
A lot of times those types of things are costing the organization quite a bit. Yeah, it's time to go, I know. Before I go, I want to give you a shameless plug for our new Master of Arts program in Social Impact Leadership at the School of Social Work. Woo woo, starting in the fall. So there's information here if you or a friend of yours is interested. We're starting to take applications, they'll be out next week. It's small, 30 credit, 2-semester program, and we have a whole class on impact measurement, impact investing. So if you're into this stuff, look at our new master's program. All right, we're all set. Do you want to say a few closing words, Annalise?
Let's give a big round of applause for Sue Ann. Sue Ann